1 minute, but I just want to make one lunchtime speaker is Dr. Sorescu, and again, at the end, we're gonna leave time for questions, and we do want you to ask your questions. For those who didn't get questions answered after Dr. Smith's lecture, we have the expert panel towards the end of the day with plenty of time there, so we should be able to get to all of them. Thanks.
It is a very difficult situation, actually, to realize that 90% of what we do every day in terms of improving the symptoms and actually probably even your life with heart failure really can only be achieved, unfortunately, not by me, but by you. Why do we need to do that? And it's really very simple. If we have heart failure makes the kidney retain salt and water in the body. And the way it works, the kidney knows that it can increase its fluid level by increasing the water level. And it knows that the water will just follow salt. So the first thing happens once our heart is not working well, the kidney will start to retain salt. And that's independent of whether you have systolic heart failure or whether you have diastolic heart failure. Whether you have heart failure because you have blockages of your heart arteries or you have heart failure just because a virus wiped out your heart. And the response is exactly the same. The kidney somehow feels dry, wants to increase the fluid in the body, and it knows that it can increase the fluid in the body by retaining the salt. So really, heart failure causes salt retention, which then leads to water retention. And the water will start to accumulate. And the first thing we're going to see the water will be first in our legs. However, by the time the fluid gets into the legs, that means most of the time already retain 7-10 pounds, and you didn't even know about it. And usually those 7-10 pounds, they will be in your lungs, and they'll make you be short of breath, because the lungs are not designed to be with water. They are designed to be with air. They're light. The moment you start to have some, water retention, you're going to have, the lungs will be stiff and they'll be hard to breathe. And because it happens sometimes very, very slowly, you would not even notice that actually you're short of breath because of that, with less and less effort. The second, the fluid will go into the stomach or in the liver, and it will cause you congestion. You will start to eat less. You start to feel that you're eating the usual breakfast-sized meal that you had. You're hungry in the morning, you sit at the table, you start to eat, you eat a few bites, and then you have to stop because you already feel full. Sometimes you may feel already nausea. You already have nausea. And really in advanced stages of the disease, you're going to have actually start to vomit and will prompt you to go to emergency room. Fluid equals for you bad symptoms. And not only that you feel worse, let's say the water goes in the legs, you'll be just heavier. If it goes in the lungs, you'll be hard to breathe. If it goes in the stomach, it will be hard for you to eat. However, by itself, the fluid actually will stretch the heart too, and will be actually worse labor for your heart, for your weak heart. It will make it worse on long term. And remember, just because you see or you don't see fluid in your legs, that's just the tip of the iceberg. I always say your legs are my eyes to your heart. So that's the tip of the iceberg. What really matters is the rest of the fluid that you feel actually more in the lungs or in your stomach. So it's important not only for your symptoms. You eat less, you're more short of breath, you're able to do less, but also if you're somehow managed to stay away without actually retaining fluid, you're going to be alive 3 years later. If you don't manage so well to walk around without the fluid, about half of the patients will not be alive with us 3 years later. So why we like to control our salt intake is because you're able to eat, walk, breathe, and feel better, and also live longer. And what's really more important than anything else, you don't want to see the doctor more than once a year or twice a year. Just say hello. Okay, stay out of the hospital. In other words, if you are able to take control over your salt intake, I promise you that you will take control over your heart failure. The medicine will do the rest of the 10%, but really 90%, it's all your work. Okay? So what do we need to restrict? Do we need to restrict the salt? Do we need to restrict the water? A lot of our patients actually get mixed signals from us because a lot of times what we learn is a moving target. Now, most of the physicians will tell you that you need to restrict your fluid in the diet. That is a very incorrect statement. Very few patients really need to restrict their fluid in the diet. Only the ones who are really incredibly sick in the hospital. I think for anybody who is walking and is at home, the fluid restriction should not be the goal. I think anybody who can drink, is allowed to drink 64 ounces of fluid a day. That's about 2 liters a day. That's perfect normal. Now, if you're somebody who drinks a gallon a day, now that is a problem because that's not natural. Remember, what water does just follows the sodium. Really, water has electrostatic charges that is attracted to the sodium or other cations. And because sodium is the one that actually controls what's happening with the water, what we need to do is actually not to concentrate on the water so much, but concentrate on the salt. And when we say salt, really the salt is composed of 2 chemicals. It's sodium and a chloride. And again, chloride comes with the sodium. So really is the sodium the main thing that we need to do. So it's not the water the problem that I would like for you to concentrate on. It's actually is the sodium. Now, it's easier said than done because water, you can quantify. So you can say I have a glass of water, I have a cup, I have, 32 ounces of water. But with the sodium, you can't know. It's really way. So this is where we have a problem, okay? But what I wanted to point out to you is that when those patients who come in our heart failure clinic and they retain 10 pounds of fluid, I always tell them, you have not retained 10 pounds of fluid. You have retained 10 grams of salt. The water just follows. It takes 1 gram of sodium retention to retain 1 pound of water. If you can actually eat the amount of salt that your kidneys can pee, you can drink as much water as you want, and all will get flushed down the toilet. The reason why we can walk around and we can eat, usually drink any amounts of water we want when we're healthy and happy is because no matter how much water we drink, the kidney is able to eliminate at the end of the day all the salt that we eat. Therefore, if there is no positive balance for the sodium, there is no positive balance for the water. How much is important to restrict? So our guidelines that we go by, the American Heart Association guidelines, say that you should try to restrict your sodium to less than 2 grams a day. Okay? I have a problem with that. First of all, we tell you, please quantify your total intake of salt a day. Okay? And I actually tried to do that. I just made like a little list. It took me about 5 hours to put all those together. And at the end of the day, I still had no clue how much salt I ate that day. Then I'm going to ask you, okay, it's 7 o'clock. I'm going to sit for a Super Bowl. Okay, let me see how much sodium did I eat today. 1,800 milligrams. Let me see what I have in the fridge for 200 milligrams so I can comply with Dr. Sorescu diet. Okay? So I'm asking you, I'm giving you a formula to use, and yet it's impossible to quantify. As a matter of fact, I ask these questions to the physicians that I work with every day. I have asked this question our nutritionists that work every day. So I ask, have you ever tried to do that for yourself? You know what they say? No. Okay. And then I said, well, please do that. And I said, I'm going to give you $100 when you tell me how much time it took you to do that. Okay. And truth is, it's a very difficult task to do that. And if you cannot quantify it, by the end of the day, be able to comply with it. We are asking you the impossible, okay? So then I thought, well, we got to develop then a method to really keep it simple for you. The reason why I came, into this country is because I love the multiple choices, okay? Now, if you have heart failure and you live in this country, that is the problem. You have too many choices, okay? So we got to keep it simple for you and try to help you out. So the way we start is very simple, okay? Somebody who is new to the heart failure, we call the nutrition consult, okay? And we call the nutrition consult, and they come and talk to you. So what do? Well, they give you a handout of 20 pages. They talk to you about, 5-10 minutes. And then you're supposed to memorize those pages, then go back and forth and keep memorizing. And then you have to take the 20 pages to Kroger or Publix. Make sure you comply when you buy your stuff from there. I think we need to change this. So what I'm planning to do is to teach you something else. First of all, who needs to restrict their salt in the diet? Not just because you have this label diagnosis of heart failure doesn't mean you got to restrict your salt in the diet, okay? Maybe what you're doing already is already good. Is there anybody here who has not been in the hospital for heart failure because of the fluid accumulation? Good. So you can go home right now. You don't need to listen to this, okay? All right? Very good. But for everybody else who is suffering from fluid and has to take the diuretics, then it's very simple. You should comply with whatever it takes you so you don't get fluid in the body, okay? That is my opinion. That should be the rule of thumb. Truly, one size does not fit all. I have patients who can tolerate 10 grams of salt a day. I have patients who can tolerate 4 grams of salt a day. But I have some patients really in advanced stage of disease, particularly if they're on high dose of diuretics. They cannot tolerate even half a gram a day. So, they still swell up. We have a problem there. So I don't think that's correct. I think what it really matters is that if you retain water, okay, you're eating too much salt, period. I know somewhere in your diet there's too much salt because your kidney cannot handle it. So I have a problem with one size fits all, like our American Heart Association guidelines. And I also wanted to tell you the best kept secret in America when it comes to heart failure, okay? The true science behind it, and nobody tells you, is that your body does not make salt. It's sodium is the smallest element. It can only be made by the Mother Earth, not by us. If you swell up because you ate more salt than what kidney can eliminate. That means it's your mouth that does that. About a year ago, I had a conversation with one of our patients. His name is Paul. So Paul went through an open heart surgery. We have done well with medicines before, and I promised him the world after the open heart surgery. So despite that, actually a month later, he comes back to me and said, Dr. Sorescu, you said I'm going to feel good. I have 20 pounds of fluid on top, and I'm sure of it. I don't know what's happening. The surgery didn't do much. So I said, well, I'm sorry, Paul, but I think the problem is that you're eating too much salt. And he said, no, and by the way, this is the most honest human being I ever met. I'm sure that, he's trying his best to really comply with the salt intake. I said, but Paul, I look at you and you have 20 pounds of fluid. You really have 20 grams of salt in your diet. No way, I'm watching very careful everything I'm doing. Well, but, you know how Einstein defined insanity. So, no, how did he do that? Well, it's very simple. He said that insanity equals doing the same thing over and over, and then each time expect different results. So if you're swelling up, it's because you're doing what you've always done. So if you've always done what you've always done, you're going to always do what you've always done. Pretty much whatever are your dietary habits, you're putting too much salt in your mouth. Then I don't understand, because I'm following exactly what you told me. I'm eating less than 2 grams of sodium a day. I'm watching everything. I'm not adding any extra salt. So what's the miracle? How am I getting all that salt in the diet? Okay? Well, let's see. What did I tell Paul to do to actually successfully really reduce his salt from the diet? So I'm going to tell you now how to do it. It's actually very, very simple. This is what you need to do, okay? Just follow my boss advice. Like Randy Smith rule. If it tastes good, spit it out. Now, a lot of you, including myself, will have a problem with that. If we could all follow this, it would be awesome, okay? Unfortunately, it's not very realistic, and a lot of you may not choose to do that. So let's try to come up with a different plan. Well, my other plan is this. Let's go to Mother Nature. Let's see those guys who actually have already solved the problem. Let me see if I can learn something from there. So it turns out that somewhere in northern Brazil and southern Venezuela is actually it's a last tribe actually of humans on Earth who live exactly the way they used to live in Stone Age 10,000 years ago. All right, they are totally a culture. Well, it turns out that you eat how much salt they eat less than half a gram of salt a day, all right? Now, that's pretty tough, you'll think, right? But despite all that, they've been alive for the last 10,000 years, and there's got to be something there. And then, so I went back and I said, well, how do they do that? Well, what they do, they have a very simple secret, okay? They eat only food from Mother Nature. Some of you who may want to really comply completely with the low salt diet, so you don't have to ever go in the hospital, you may consider translocated there in that place. Now, we are here, and let me give you some tips how to do it, okay? Inspired from that, I went back and I said, it's very simple. Those guys eat less than half a gram of salt a day. maybe I should devise some rules that will let them, will teach you how you can do that without having problems. So, well, the first thing, you got to start to quantify the sodium. So let's start to leave the labels. The beauty of living in this country is by law, if anybody sells anything, they're required to tell you how much sodium is in that product. So I think that's a very powerful tool that you have there to begin with. We just have to do it in a way that makes it very easy. So let's read the label. So we have bread from Publix, all right? We have Cheetos. Raise your hand who thinks that Cheetos has more salt. All right? Raise your hand who thinks that bread has more salt. We have 2 people who voted twice, so that's not fair. All right. I do believe that actually probably most of you voted for Cheetos. Well, let's see if that's correct, okay? Let's read the labels, okay? Sodium, 140 milligrams, okay, per serving. How much is a serving from bread? 1 slice, one thin, very tiny thin slice, okay? I'm not talking about, bun. I'm not talking about bagel. I'm not talking about, 1-foot sandwich bread. I'm talking about slice, okay? So if you were a conservative eater of bread and you only eat 2 slices per meal and you eat 3 meals a day, because that's what we're supposed to do, then you get 6 slices times 140. You already got close to a gram of sodium a day just from your bread. Now let's look at Cheetos, okay? Cheetos, sodium, 290 milligrams. Sure, that's a lot, but that's per serving. Turns out the serving is the whole bag, okay? And, the problem with that, you have to always take into account actually the human nature. So if you were to eat the whole bag of Cheetos, you'll feel guilty after that, and you'll stop eating after that, the Cheetos. I promise you. I mean, most of you are serious people. They're trying to do the right thing. Chances are that if you were to ask me, look, doc, there's no way. Either I eat Cheetos or I eat bread. Which one would you recommend me to eat? I will tell you, please eat your bag of Cheetos, cut out the bread, okay? If I have to do it according to the low salt intake, okay? What I'm trying to show you here, that actually there's sources of sodium and salt in your diet that you never thought about. What I'm giving you rule number 3 from my approach. Rule number 3 is that avoid food that says more than 100 milligrams sodium on label. This is very easy to follow. You go to Publix. You don't need to carry your 20 pages of advice from nutritionists. All you need is go and read the label where it says sodium, not where it says percent. So basically, look at the milligrams, and it has to say sodium 100, less than 100 milligrams per serving. Okay, and that's pretty simple. If you do this, the assumption is that even if you eat 10 servings of this thing a day, you're still gonna have less than, or 20, you're still gonna have less than 2 grams sodium a day. Okay, and I'm trying to make it simple. Now, some patients will still swell up if the cutoff is 100, so then you may want to cut to 80, but you can start with that. Okay, so 3 simple rules to truly restrict sodium in your diet. Number 1, stop eating out. Of course, only a non-American import can come up with this idea like me. Well, I did learn, though, going to restaurant and getting a taste of a real Western civilization, which I've been doing, is that if I eat out, someone else controls the salt that you put in your mouth. And remember, it's a conflict of interest. If they don't put salt in it, they're not going to sell the product, and they're going to go bankrupt. Now, maybe one day, all these companies will wake up, and for 100 Chick-fil-A sandwiches, they're otherwise very healthy, we'll have maybe one of them that will be for low salt, that will pass Sorescu test. But until then, my advice for you, if you're truly honest about taking control of your salt intake and stay out of the trouble, stop eating out. I didn't say reduce, I said stop eating out. Now, you're doing good. Every once in a while, we can serve yourself a dinner once a week or so, or twice a week. But first, you got to start from there, okay? Second rule. If you don't eat from humus, you got to eat from somewhere. So eat fresh food as it comes from Mother Nature, all right? So go to the natural product section. In other words, the part where they have, fresh. Whether it's fresh vegetables, fresh salad, fresh fruits, even fresh meat. As far as I'm concerned, from heart failure standpoint, you can eat any kind of meat you want. So please, have a T-bone steak every day, okay? But buy it fresh. You want to see the blood gushing out of the cow, okay? This way, the humans did not touch it, did not add salt and preservative. Then you can freeze it at home, and then you can grill it. You can add any spices you want. They're individual. Just make sure that the word sodium is skipped from that, okay? You can use various salt substitutes. for a good list. Andrea has it. She'll tell you more about that. That in general, things that are associated with Mrs. Dash, they're probably okay. But sea salt is actually worse than the regular salt for you, by the way. All right. They are correct. They say there's more pure, but that is the reason why you can use less and have the same damage. Okay. All right. So buy fresh, cook at home without adding salt. The last rule: read the labels. Of course, we live in the society where you have to eat some cereals. They're pretty good. Otherwise, they're healthy. However, or you gotta buy milk. You gotta buy various other products. They are made by humans, and they are healthy. But I would like for you to read the labels, and I recommend sodium less than 100 milligrams per serving, or 80 milligrams if you still accumulate fluid. So let me walk you through some examples, and I'll be over soon. Okay? So here's an example of this is supposed to be fresh frozen vegetables, okay? You think that, look, they're all frozen, they're fresh, they should be just fine. Well, I could never figure how come your broccoli and all this stuff, they have all the way up to 200 milligrams of sodium, okay, into this. Here's another fresh frozen product here, broccoli, plenty of them. You get only 20 milligrams. That's below 100 milligrams mark. These are good for you, okay? If you don't want to keep reading the labels, then the easiest thing to do, just go to the fresh product, and then you freeze them at home. So you may freeze food, but after you bought them fresh, they have not been contaminated by humans. All right. Now this is the best one. Just because you don't eat French fries from the restaurant doesn't mean they cannot come already with salt. These are supposed to be frozen. They're not supposed to have salt. So for some reason, they still squeeze in a little bit of almost half a gram of sodium per serving, okay? I don't know why. So it's added to preserve taste the same way. Now, so how about the pre-made dinners? They're healthy otherwise, healthy in choice. And I have nothing against healthy in choice, but I don't think there's anything healthy in your choice when your dinner has 600 milligrams of sodium, okay? So please read that, and I would not. It's much better for you to cook your own stuff at home, okay? Now, I wanted to give you two more examples of how actually the salt can come in your diet without you knowing, okay? One is the cereals, unfortunately. I might be the only person in the whole world who barks against cereals, okay? Cereals are wonderful for you. They can help you lose weight. They can help you lower your cholesterol. And, it's actually approved by American Heart Association, The only problem is that it's approved for criteria for saturated fat and cholesterol. They don't say anything about salt and sodium, okay? So you got to pay attention what is approved for, okay? Cheerios otherwise are wonderful. The problem is that to pass the test whether it's healthy for you, you have to read the label for sodium. It's 190 milligrams, okay, of sodium, all right? But how about let's choose some cereals that actually help, or maybe, all of them have it. Maybe we have no choice. This is my son, so he was really bored to death yesterday at Target. So you want to help me? Help me so I can help the patients. Here's the deal. You just hold those boxes there. I'll take a picture. So, and then I'll teach you what's the purpose for this. So we look at Raisin Bran and we look at shredded wheat. Which one do you think will have less sodium? Very good. Yeah. So that's exactly what happens. The Raisin Bran has 300 milligrams per serving, okay? And I hope you don't eat more than one serving of cereal per day, okay? The shredded wheat has actually 0. So of course, this is what my 10 years old, strongly recommends. Another favorite that I have is actually bread. Really keep in mind that whether it's white or brown or wheat bread has nothing to do with the salt they put in it, okay? If it's actually from Mother Nature, you'll have 0. So what you need to do is to read the label. This is basically 2 different brands of the wheat type bread, okay? This is the Nature's Own, all right? And this is the old-fashioned bread, okay? So, and they're both wheat. And look at this. One has 110 milligrams of sodium per serving, per slice. The other one has 220, okay? So I'm going to repeat, and I'm going to, finish with this. And I want to tell you, all these simple rules and the explanation, one page, we have the handout, and you should have it there somewhere. They're really easy to follow. But I want to make sure that you go home and you already know this. Whether you'll choose to apply them or not, that's a different story, okay? So rule number 1, everybody says after me, stop eating out. Great. Rule number 2, eat fresh food as it comes from Mother Nature. And the last but not least, read labels for sodium. It should say less than 100 milligrams per serving. less than 100 milliliters. So, well, thank you very much, and I'll be happy to take any questions.